Recently did an online consult with a client, knee pain, MRIs show nothing, all the basic orthopedic tests, nothing shows to be provocative. So you gotta start thinking maybe tissues, fascial stuff, the sliding surfaces of tissue, creating dysfunctional movement in the knee. So some stuff we can start doing to address kind of a knee pain issue that's not showing up to be a severe structural abnormality. So without actually looking at somebody's hips, looking at their movements, a couple basic things that just about everybody could benefit from. Some tissue work to the quads, to the adductors, to the calf, making sure ankle range of motion is good, making sure hip range of motion is good. So I'll show you a few things. I'm losing my balance, I'm on the floor. So a few things you can do. Tennis ball, lacrosse ball, better. Start with just foam rolling the quads. This isn't a foam roll video. I've got other foam roll videos. And start moving that tissue so it's able to contract, relax. It's not full of adhesions. To get more aggressive, lacrosse ball, you're going to put it at varying positions all around this quad tissue and go through some kind of active mobility. So I put some pressure into that ball, crank up the knee. Do a couple reps, find, move the ball to another spot, crank out a few reps, and just keep moving around, find tight tissue. So you're essentially pin and stretching tissue, mobilizing that tissue a bit, up and down the quad. And get more lateral onto that vastus lateralis, which will get bound up with the IT band. So, fascial kind of tennis ball release all around the quad. Lateral hip. So think TFL, glute medius, glute minimus. This can suck. You got to embrace the suck. Lots of trigger points in here, sending some pain down to the leg or the knee. That TFL muscle, the fascia, all the connective tissue from that muscle becomes the IT band. And so if that muscle is chronically spasmed, it can put a lot of stresses on the IT band, which can play some funk into the knee. So that's easy. Foam roll, lacrosse ball stuff. Calf tissue. Your gastrocnemius is that bigger tissue. Deeper is soleus. Then even deeper, you've got some muscles that help control the ankle, stabilize the foot arch. But if those bigger calf muscles, the gastroc, it crosses the knee joint and attaches up onto the femur. So if that's not contracting, relaxing, or having enough flexibility and limiting your ankle range of motion, it can hugely affect the knee joint. So you can foam roll the calf tissue or just start getting more aggressive. I'm getting all burpy. I just ate a bunch of chocolate. It's good though. It's good burps, chocolate burps. Grind around in that tissue, find where it's tight. I'm a little tight right there. Put some pressure down into it, and then I start taking my ankle through range of motion. So again, I'm kind of pin and stretching that tissue. So easy one. You can go manual, hands, grind into that just behind the tibia, into that kind of deeper calf tissue, tibialis posterior and soleus. And then we want to kind of mobilize that new range of motion in the ankle. So good foot arch. I just drive the knee forward. You can do this against a wall. And I'll get into some other ankle range of motion stuff, but really you're looking to keep that foot arch, drive the knee forward. This will increase over time. You've got to have that posterior calf tissue pretty flexible to allow proper range of motion in the ankle so you're not adversely affecting motion in the knee joint. So a bunch of fascial release stuff, just a good quad rec fem psoas stretch. Come on up. Don't stick the ass out. Tuck the butt under. Get into what we call a posterior tilt. That puts a bit more tension on the rectus femoris muscle, which is one of the quad muscles. And you start getting into some psoas, some iliacus, other hip flexors. Come up, stretch, breathe. Get zen, breathe, stretch. So a couple easy things for knee funk. Another one. Adductors. So it's these groin muscles. So they attach all the way high up on that pubic bone, right by the jewels. So all those tendons up there can get a little tight. You can actually go through there and release some of that tissue, or have your lady friend release your adductor tendon tissue, whatever. So that'd probably be a little more delightful than having somebody else do it. So lower adductors, I'll use the elbow, not pointy elbow, come up to this broader portion and just start doing some pressure behind. So here's the knee. You can feel the big head of the femur. Just behind it, you'll feel it start to drop off. And that's where you start getting into adductor magnus, gracilis, come higher, adductor longus. And all that can be really sensitive tissue. Just take some time, sink in, move it around. All those, plenty of things to start working on. A little knee funk, a little adductor mobilization after you release that tissue. A couple reps. That's it, a couple easy things. Again, start working on the tissue health. See if that's contributing to knee pain. Surfing with knee pain sucks. So yeah, use it. Check out surftrainingsuccess.com. Gives a full rundown, a lot more specific of all the techniques and soft tissue work and mobilizations that you can start using to deal with quirky aches and pains that are kind of nagging you. Yeah, dig it. Use this stuff so you can surf, not hurt. I'm Chris. Later.